guys, this is Dr. Aman Setiya from DBMCI. So I'll be presenting you the verdict of FMGE 2021 December exam. So if I say the exam was little bit tricky, there were easy questions, but they were twisted, and in fact I can say they were twisted a lot. So let us discuss a few points about what will be our strategy in future exam, how to approach this kind of paper. So let me say first thing is the exam paper. If I say the level of intensity of this exam, how to grade this, if I talk in our language, it is mild, moderate, severe. So it was moderately severe. So exam was not an easy, it was moderate to severe. This is a medical language for this exam. Next thing, if I say there were question based on, there were clinical questions. There were more clinical questions. So this is something which I was telling you before, that they will give you some hint about a next pattern. So they have given this time again. Last time also they did the same. So what is clinical questions means? There were more clinical based questions from medicine. There were a lot of questions from medicine, and they were mostly clinical based. There were clinical based questions from pediatrics, from OBG. So these were clinical questions which were, these three subjects were the most, you see, medicine, pedia, OBG, all were having clinical questions. If I say the third thing about this exam is, there were images. So these images will include ECGs, some radio images, some gynae images, and there were images from ENT optha as well. So I can say the exam was a mix of everything. So this was like a full-proof clinical oriented exam. Even the questions from pre and paraclinical subject, I can say, like even the questions from anatomy and the questions from biochemistry and question from microbiology, question from pathology, they were also giving you somewhere, they were associated with clinical subject like orthopedics, like medicine, like surgery. So this was a full proof of integrated learning. So they were giving integrated questions. Okay, if I say there was very less or few one-liners, there were very less or few one-liners. So this is what I perceive overall review of this exam. If I talk about my subject, which is medicine, so if I say the medicine review, so this was an overlap. This medicine, if I say there were questions based on cardiology, as I told you, cardio is always important. There were questions from neurology. So there were around 4 to 5 questions from cardiology, around 3 to 4 questions from neurology, and there were around 3 to 4 questions from general medicine. There were 3 to 4 questions from general medicine. This include ABG and electrolyte. So they have targeted the things which students don't study, and they have targeted the things which teacher says in the class that these are important. There were a few more questions from respiratory section. And there were also a few questions from topics like, especially in hepatobiliary, they have asked few questions on ascites in hepatobiliary system. So this means they have touched almost every section of medicine. So what questions we got? These are recall questions from students. So around 270 to 280 questions we received from students, and their feedback from students is same. The paper was a bit tricky. So what will be my advice for you? First advice will be, what we don't study is, like in many institutes, in many apps, you see there is a concept for students like they will study one-liners and they will pass the exam. So there is no game for one-liner anymore. So this is what I perceive is one-liners will be less in future MCQs. So if I say about one-liner, what will be my prediction? There will be very less question in near future from one-liners. So focus less on one-liner. This will be my advice. You should focus less on one-liners. In fact, you should be giving your more focus towards concepts. Because those students who were having solid concepts, they did well in this exam. Those who were studying with normal textbook, they performed well in the exam. Okay, third thing about misconcept is like many institute, you'll see they say don't study medicine. So if you see the paper, there were around 40 to 50 questions from medicine. Yes, I am right. It is 40 to 50 questions from medicine alone. And if you try to relate this, there will be 5-6 questions more. So medicine is always one thing that you should always study. So remember again, one-liner game is less. If I say no more game for one-liner. Focus more on conceptual learning. Focus on subject like medicine. There were questions based on surgery. So these are like they have asked the question which are real scenarios. Like I have seen there were questions based on ECG. What will be the next management? What will be the next investigation? How to approach this? So these type of question means these are real actual patient based scenarios that they have asked in exam. Real patient based means what we see in practice. Like I have came across a patient, a question which was a same question like similar patient came to me in my practice. So what I want you to learn, you to take a message from this is there will be no more game of shortcuts anymore in this exam. You have to study all 19 subjects. So just if I elaborate this, many of students what mistake they do is they ask a question to faculties or to teachers, which subject should I skip? The answer is no. You should not skip a single subject. Okay, then on the other hand, some students what they think, if exam they are giving on next pattern, should I be going with only 4-5 main subjects? Answer is again no. It's not possible to understand medicine without physiology, without pathology, without pharmacology. Similarly, it's not possible to understand surgery without anatomy. So what is, you should be hitting, at least make a reading of all 19 subjects. Then understand this. Second thing is, there should be no skipping of a single subject. If I say the second point which I want to focus here is, you should focus more on concepts rather than the one-liners. MCQ solving. So if I say this MCQ solving, this is also an art. MCQ solving is also an art, and this art is developed over periods. Over periods means when you solve more MCQs, you will develop this art. So in exam, most of the good students, they will have confusion in 4 options. 2 options. Means 2 options they can rule out. So they are confused. Either the answer is either A or D, because B and C they have ruled out. So understand this, how to sort out this confusion by solving the questions multiple times. So make a habit of solving multiple questions. So this time paper was very fresh with the new questions, more questions, a different question, different pattern of question. Like if you see like hematology is always important. So from hematology they have asked around 4 to 5 questions more focused on B12 deficiency. If you see, that was examiner favorite topic this session. They focused more on leukemias, especially CML part. They focus more on ECG, basic ECG. I told you it's a screening exam. They cannot give you difficult question, but what they did, they twisted the simple questions in a difficult way. So MCQ solving is an art. What I am telling you is try to solve maximum questions so that you can rule out other choices and then you can go for an answer. For example, there was a question based on ECG. Narrow complex QRS was given. Other options were for broad QRS, so that you can rule it out. So ruling out is a much needed thing. So MCQ, how you will solve? By ruling out slowly, you should rule out other options. Third thing is, if I say which subject to focus more, so this should be in a sequence. If I say, again, you should learn the sequence. So clinical subjects are more important these days. So focus on medicine. surgery. This I am writing in a sequence. OBG. So, and pediatrics. Like many students, what they were saying before, like many of your seniors might be telling you, don't study medicine. Many institutes people, they are telling, don't study medicine, skip it. Even if you study, you will not solve. Okay, I can say I'm ready. I'm agree with this fact. You'll study microbiology, 17 questions, you can get 15 correct easily. If you study medicine, even you study a lot, there are 30-40 questions, you will solve only 50%. But that 50% matters a lot. You see the paper with 50 to 60 questions from medicine, 50% of that will be 30. 30 MCQs are more than any other thing. And when we study these subjects, they will give you some recap of other subjects. Like medicine will give you a few recap of pathophysiology and pharmacology. Surgery will give you a quick recap of anatomy. Similarly, OBGYN will give you recap of gynae as well, recap of anatomy as well. Okay, so pediatrics is beyond growth and development. It is beyond milestone. They ask near about 5 to 10 questions which are disease-based questions from pediatrics. Right? So now they don't ask question like when a child will do bye-bye, when a child will draw circle. Now they are asking corneal atresia. They are asking Gilbert syndrome. They are asking PSGN. They are asking pediatrics disease-based question. So this should be in your mind, that there is how we can approach this. Your basics should be strong, only then these 4 subjects can be strong. So this is what they have given you. They have given you the next pattern. So if I conclude this, what I can say is like exam was a little bit tricky. There were easy questions, but they were little twisted. Even some questions were so tricky that students could not recall even 4 options. And in fact, 10 to 20 questions were so difficult, they were of a level of, if I grade this MCQ, so if I say there are 300 MCQs, out of these, around 100 MCQs were simple. 100 MCQs were simple, easy questions, repeat questions from DNB books, repeat questions from FMGE books, repeat questions from previous year papers. So basically these were simple questions. If I say next 100 questions, these were simple questions, but they were twisted in a case-based form. Twisted means, for example, they can directly ask you what is the translocation of CML, but they have not asked this. They have given you a case-based scenario, a 60-year-old man with presence of myeloblasts. Then they are asking you what is the translocation associated with this. So that is a simple question, but little twisted. Okay, if I say 50 questions, 50 MCQs, these were twisted a lot. These were twisted more, means most of the student, they had difficulty or confusion in 2 options. And if I say other 50 questions, these were new. These were new questions, and they were asked for the first time in FMG exam. They were also never asked in NEET PG paper. So these were new questions. So that is what I can say is like you will see all the teachers, all the institute, they claim like all questions came from my notes. Everything is coming from, but you should understand this, from 300 only 250 questions will be coming from the notes. The rest 50 questions you need to have a approach. You need to have strong basics. You should be having clinical command. Only then you can solve this. So what we are planning is, we are planning to elaborate little these things a lot. So like if you attend an offline class, so like we teach medicine for 50-60 years, because like institutes, they don't allow more than this. So what we are coming with, this will be a huge discussion with focusing on, like if I can say, like I have taken a live class in almost many different institutes, but there is a topic called magnesium. In electrolyte imbalance, there is a topic called magnesium. I skipped that topic because of the time limit, and there were 2 questions in exam from magnesium. That is my mistake. I skipped the topic because that was less important, because sodium, potassium, calcium are more important than that. There were questions from potassium also, but I never expected from FMG, in FMG paper there will be a question for magnesium, and that question came in exam. So what is this time we need to study, and all these questions, if I say like I have taken a closer look on medicine questions, these questions, if I say the reference of this question, came directly from Harrison textbook. So understand this, I am not telling you to study Harrison, I am telling you we at DBMCI will teach you Harrison not for 40-50 hours but for 70 hours. So whatever it is, you have given the exam, but what I can say is this simple question, this simple and twisted question, and this little twisted question, these are more than sufficient to pass this exam. So we'll be shooting recall questions, then try to match this, and don't panic. There are few questions which you might be feeling low, but you did well in exam. It's time to enjoy. Enjoy whatever it is. Wait for your result, and after result you will come to know. I wish if you pass this exam, then prepare for PG as well, because this is one of the twisted exam of FMG career. Like I have been teaching from past 6 years, what I seen, this was the most twisted paper till in this last 6 years. So all the best for your result. You guys did well, and I want you to all to pass this exam with flying colors, right? So I wish all the best. Wait for result and get back your preparation with PG study. So they have given you the pattern, and advise your juniors. I don't want to teach you again. I just advise your juniors to follow on these subjects. So this will be advice for the beginner or new FMG students. My advice to the students who have given the exam will be a good luck. So I am waiting for your result, and all the best. Just be focused, be calm. I told you before, the exam you can, you will. What I am telling you now is you did. All the best. Bye-bye. Take care.